So COVID in pregnancy, I'd like to start this class again since we are now on record. Let me just do a couple of announcements for my students. For the October theory going batch, yes, I'm going to be coming up with a package which includes all the theory materials together. I understand that you people are having a little bit of confusion running across a couple of packages on my app. So for your ease, I'm trying to consolidate them up all together. Though I had made a couple of my videos. One video was on how to access the study material for the theory course. One video was on how to access the study material for the practical course, but I made it easy. There is one consolidated package in which everything which will solve the practicals for you and the study material for practicals for DNB is there as one consolidated package. Currently, it's also running on a discount. And I'll now make it easy for you for the theory package, because earlier on, some of you had mixed, demands. Some of you wanted just the theory material. Some of you just wanted the answer bank, and some of you just wanted recent advances. Earlier on, believe me, there were requests only for recent advances as well. So what I'm now going to do is that, one thing definitely about my complete theory course, those students who prescribe to my complete theory course get 2 bundles free of cost. One is my live classes, which I'm taking right now, and the other one is my recent advances package, which I give free to my regular students. So what I'll do now is that I'll also consolidate answer bank, put in a little bit of discount so that it's easier for you to buy it, and put it together as a package. So those of you who want to buy the consolidated theory course, they want to prepare everything for theory, can come and purchase it. And the rest of you, of course, for you, the separate packages will always be available. For anybody who doesn't want to take the theory complete package, can go ahead and buy the answer bank alone, or whatever you feel like, permutation and combinations up to you. But yes, I'll make it easy for the students who have, because in the recent past, I've got many demands for a consolidated theory course in which they get everything. So we are working towards it, and very soon we'll be announcing. So let's begin with the class tonight, and it's on COVID and pregnancy. Right now, see, when last year there were students who would ask me, ma'am, what will be the oft repeated questions in the paper 4? Everybody is dreading of the paper 4. So I had one definite answer that it's going to be COVID and pregnancy. In one way or the other, they're going to be asking you the vaccination and pregnancy, or effects on the mother, or the management of the COVID patient in labor. These are kind of permutation questions are going to be asked, and they were asked in different forms. Right now, I would say the demand, or let's say the possibility of this question being thrown again in your examination has got a little less than what it was before. But nevertheless, it's an important topic, and you should study it once and for all. So let's begin about, so this, this topic, this PPT I have made basically on FOXY GCPR. This is good clinical practice recommendations. They are recommendations, not guidelines. So we should just remember one thing, that these are from our Indian perspective, all right? This is not from any foreign guidelines. So we are talking about Indian perspective, which makes it even more authentic. Recommendations are got by FOXY. I take them up very seriously because they are based on human population, right? So let's begin. The introduction I'd like to give by that, of course, you know that coronavirus was a new strain. It was one of the SARS-CoV viruses, which earlier on was responsible for causing, an acute respiratory disease kind of a thing. It was a similar strain and was first identified in Wuhan, in China. All of us know about it. It was declared again a pandemic by WHO in March 2020, and we had a huge toll of morbidity and mortality in the year 2020 and 21. So let's talk about its effect on the pregnant women. Okay. So the first thing is that we'd like to know what should be measures of, measures taken by the pregnant women to just prevent COVID-19. If suppose, you're handling an antenatal OPG, you are seeing the, patients who are pregnant and they're coming to you who are not obviously falling sick or who are not yet, into this infection. And they're very, very worried regarding every next patient is going to ask you, what should I do to prevent myself from getting this dreadful disease? Your answers are going to be including these. Do the 5. Okay, do the 5. That's what's written over here. That's the motto, do the 5. The 5 are stay at home. Until unless you really need to go out, stay at home. Call your practitioners, or call your, over there you have midwives. This is an Indian scenario. So you have to talk about home care personnel, or try to avoid the maids coming over, going there, staff members and coming and going there. Call, mostly everything should be done on call, take the numbers, talk to your physicians when they have to come, make an appointment. Until unless it's very necessary, to not go. I'll be talking about it later. But yes, if suppose you have to get certain investigations done and then you have to show the patient also, don't make it 2 visits. Make everything in 1 visit. Get the investigations done and then go and visit your physician. Also tell them to encourage you so that you know that in the next visit, if they have to come getting the investigations done, they do not have to come first, sit, get the prescription, what do I have to get next, then go and get it, and then again go back. So that means this is 2 visits instead of 1. So cut short on your visits. That's one. Keep washing your hands, preferably with an alcohol-based hand rub for minimum 20 seconds. Even a soap water can also do. Instead of using your hand to cover your mouth and face while you're sneezing or coughing, use your elbow. Avoid touching your face, eyes, nose, mouth with hands because your hands are mostly contaminated, and keep a space. Keep a distance of 1 meter from the next person, which everybody knows by now. Now, if I ask you what were the effects of COVID-19 on the mother, what will be your answer? What will you say? Do you remember what were the effects? What happened? And do you have any memory of how the COVID behaved on pregnant mothers? See, when it started, we all were anticipating that it's going to be dreadful for pregnant females. You know why? Because immunity is all-time low, number one. Then COVID had a very notoriety at inflammation and basically causing coagulative disorders. I hope you do know that, because at some point in time, Ecosprin was very, very helpful. Heparin was very, very helpful. So they had a notoriety of developing that, this inflammatory coagulable syndrome, and in which we were dreading more in pregnancy, because pregnancy is a hypercoagulable state. But what my experience was that, what I found that in pregnant patients were not at a higher risk as compared to the other normal population, just because they were pregnant, or they were at an all-time lower rate of immunity, is what I got from my own experience of my patients, right? All of you must have worked in your respective gynecological departments. You must have seen many such patients. So I'm sure that your experience could be different from mine, but what I saw generally was this, that I found that, see, it's written over here, and this is what I wanted to brief you, that the pregnant females were found not at a higher risk of developing COVID. That was almost similar. So that was a sigh of relief for all of us. So what was the mean incubation period we saw? It was around 1 week. Basically 5 days to 7 days. I've seen people getting infected even in 3 days. Okay. Incubation period starts at 5 to 7 days, and most people will start showing features by 11 days of exposure. Pregnant women are no more likely to get infected, no more likely to get infected than the general population, which is very, very surprising, but it happened like that. Also, pregnant women do not have worse outcomes. That is also there. Suppose one does get pregnant, okay, would she have a worse outcome? It was not seen. What about the effects on the baby? We'll discuss in the coming slides, but this were the effects on the mother we're talking about. Majority of people pregnant in general population may be asymptomatic or present with certain respiratory symptoms, and most of the female patients who are, these pregnant patients will have one of these features: a moderate flu symptoms. That means malaise or fever or sore throat or cough. And few may have difficulty in breathing and shortness of breath that might not be requiring ICU admissions as well, right?